what ECG finding is shown here. Hyperacute T wave, T wave alternance, T wave inversion, artifact. Right. So this is suggestive of your hyperacute T wave. Now, this hyperacute T wave, whichever is being shown here, what is the diagnosis suggestive of? What is the diagnosis suggestive of? Not hyperkalemia, Yashaswini. It is not hyperkalemia. Anyone? Very good, Pradeep. Yes, all of you, whoever are answering now. So this is an early ECG changes in MI. Right? Early ECG changes in patients with the ST elevation MI. All right. So now, why is it considered as the ST elevation MI? Because these patients, they are having broad tall T wave. So broad tall T wave, it is suggestive of your MI. Whereas in case of the hyperkalemia, how is that you will have? You will have narrow tall tented T wave. You have narrow tall tented T wave. That is what you will have in hyperkalemia. Whereas in hyperacute ischemia, you have symmetrical broad based T wave. Right? Symmetrical broad based T wave. Okay. So this is about your morphologies related to the T wave. Now, the earliest ECG change in MI will be your broad tall T wave, followed by that ST segment elevation, followed by the disappearance of your R wave, followed by that appearance of the Q wave, followed by that you have T wave being inverted, and at one point of time, after a very long duration of the STEMI, you will have only Q wave, all other changes will disappear. Okay, right. Then, yes. 50-year-old man develops an excruciating headache. Examination, nuchal rigidity. Non-contrast CT performed after 4 hours showed blood in the sylvian fissure. What does the ECG shows here? Okay. Can anyone tell me what is the diagnosis of the ECG and patient? Diagnosis. Right. So diagnosis is suggestive of subarachnoid hemorrhage. So whenever there is subarachnoid hemorrhage, there will be raised intracranial pressure. Right? There will be raised intracranial pressure. Okay. And whenever there is raised intracranial pressure, you have the ECG changes as the T wave inversion. And that too, it is like global T wave inversion. So just now I was discussing about the raised ICT where you will have global T wave inversion. Except your AVR, right? In AVR, right? In AVR, you will have the upright T wave. Right? You will have the upright T wave. Okay. So that is about your right. That is about your the ECG suggests. Yeah, this is called cerebral T waves. Right? Where you will have broad, deep T waves. Right? Broad, deep T waves, which are nothing but cerebral T waves. Next. Now, a 65-year-old man is brought with complaints of breathlessness and chest pain for 18 hours. ECG was done. Which of the following statement is incorrect? Just zoom the ECG and just observe which of the following statement is incorrect. Right? Very good, Agara Mudavalan. So the answer is your premature ventricular contractures are not observed. Can anyone tell me what is the diagnosis of this ECG? What is the diagnosis? Very good, Agra Mudavalan. So that is anterior wall MI. Right? Anterior wall MI. Okay. The rhythm, if you observe normal sinus rhythm, ST segment elevation is there from V2 to V4 and axis is normal axis. And tell me which vessel is blocked in this patient. It is left anterior descending artery, right? Left anterior descending artery. Okay. Now tell me, the patient is having chest pain for almost 18 hours. Right? The patient is having chest pain of almost 18 hours. Now tell me, which revascularization therapy should not be done? Which revascularization therapy should not be done? Very good. The answer is thrombolysis. The answer is thrombolysis. The thrombolysis should be done only up to 12 hours. Right? After 12 hours of chest pain, there is no role of your thrombolysis at all, because by 12 hours, the myocardium might have been dead. So there is no point in like doing the thrombolysis and inducing the hemorrhage at other places, because thrombolysis, what is the adverse effect? Hemorrhagic stroke. There can be like rupture of the blood vessels. Then what about the PCI? Right? What about the PCI? You have to do PCI after testing for viability. Right? After testing for viability, if it is like viable myocardium, then you can do PCI, but there is no role of your thrombolysis. Okay, percutaneous coronary intervention can be done. Right? But thrombolysis should be done only up to 12 hours of the onset of chest pain. That's a very important question. Next. Yeah. Comment on the diagnosis from the ECG shown below. 2:1 heart block, trifascicular block, first degree heart block, atrial fibrillation. Oh, why you people are answering it as first degree AV block? Huh? We have only the correct answer coming from Arjun and Agar Mudavalan and all of you who are answering now. Okay, so the answer is 2:1 AV block. Right? Sumaya, I'll just answer all your doubts in the end. Okay, so the answer here is the 2:1 heart block. 2:1 heart block is the answer here. So it is not first degree heart block. In case of first degree heart block, what will happen to the PR interval? The PR interval will be prolonged in first degree heart block. And if you observe the PR interval, is it prolonged here? No, the normal PR interval is like 120 to 200 milliseconds. And how many small boxes is this occupying? It is occupying like 4 small boxes. 4 small boxes in the sense the PR interval is around 160 milliseconds, which is the normal. So it is not your first degree heart block at all. Okay. Then it is not atrial fibrillation because you are having the presence of P wave, right? And it is not your trifascicular block as well. Trifascicular block is nothing but like where there is block within the right bundle branch, left anterior fascicle, and as well as left posterior fascicular block as well. So this is the ECG suggestive of 2:1 heart block, where you are able to observe this is one P wave and QRS complex is there, and this is the second P wave, right? One P wave you have, and then you are having the second P wave. So for 2 P waves, you are having one QRS complex, right? For 2 P waves, you are having one QRS complex. So this is what is nothing but your 2:1 heart block. Okay, this is suggestive of your 2:1 heart block. Okay, right. I hope everyone has understood this. The answer is 1. It is not your first degree heart block, right?